world, this is Dr. Rico Short. I want to talk to you guys about irrigation. You know, I'm very passionate about irrigation, and the last video, if you saw it, I talked about Chlor Extra. So I'm going to show you some of the main irrigants that I use. So the first thing is we talked about Chlor Extra here by Vista, and I like the way their lure lock system works. You put the syringe on top, and then you just pull it up, and then you'll see the solution comes up here. Very clean, and you twist it, and then notice no drip. So I'm gonna put this here. This is the Chlor Extra, and then the other solution that most people use is just standard bleach. But this is pretty interesting. I just noticed that the standard bleach now, instead of 5.25% or 6%, is actually 7.5%. So this is non-diluted, store-bought regular bleach here. And so we have some here. And because you have the store-bought bleach, you don't have the lure lock system. So as a dentist, you have to put it into a little cup here, and then you draw it here, but sometimes it drips. I'm gonna put that there. And then we talk about SmearOff. And what is SmearOff? It's a 2-in-1 EDTA-based formula enhanced with chlorhexidine by Vista Apex. So a lot of times we want to use chlorhexidine to further disinfect the case, but we know if we add EDTA to chlorhexidine, you know, sometimes we can get some issues if we use the sodium hypochlorite if we don't rinse it with saline. So we're going to pull this up here. So we have the SmearOff here, very clean there. So here we go. So this is the chlorhexidine here. And so we use chlorhexidine, like I said before, to further disinfect the root canal system. However, if you don't rinse the chlorhexidine well, and then you add the sodium hypochlorite to it, it's going to give you a brown precipitant, which some of the studies show that it's carcinogenic, and it can create some issues in the case. So I'm just going to show you here what happens when you add the sodium hypochlorite, if you don't rinse it well with saline, directly to the chlorhexidine. Can you see that? So this forms this nasty brown precipitant inside the root canal space, and believe it or not, some of the studies show when you combine these two, it can be carcinogenic. So we don't want to do that. Or if you're going to use that, you have to make sure you rinse the canal out very, very well with saline. But if you want to skip that step, guess what? Vista Apex have a 2-in-1 called SmearOff, and the EDTA and chlorhexidine is built inside. So when you are using the solution, you don't have to worry about any kind of brown precipitate that forms when we are using the solution. So I'm going to show you what happens when we add the Chlor Extra to the SmearOff, even if we didn't rinse it. Sorry, I got a little bit on my hand there. So this is the SmearOff here, and then this is the Chlor Extra. As we add it, you see there's no brown precipitate that forms, so we don't have to worry about those issues. So you can rinse it with saline and Chlor Extra before you use the SmearOff, or you can go directly to the SmearOff and you don't have to worry about the brown precipitate. And again, the SmearOff is a unique formula that has the EDTA and chlorhexidine built in. So I want to show you that because we don't want you to have cases that have this stuff in it. All right? I'm going to show you a clinical case of SmearOff in action. Then the SmearOff, but SmearOff is also like high-powered EDTA with chlorhexidine in it. So it really gets in there and get that canal system very nice and clean and remove all the dentin mud there so that you can open up those dental tubules. And then we use the micro aspirator tip that can get really deep inside the canals, that can really help you save time drying the canals and also allow you to irrigate very, very well with nice suction here.